So I am going to call this meeting to order for the Board of Health for Chelmsford, Massachusetts, March 1st, 2021. And I think that welcome everybody. And otherwise, I think our first order of business is the approval of the minutes from the last meeting. So I'll let people look those over, and then I will entertain. I'll have Anne Marie go first, and Linda go second.
Okay, Linda, yeah, Linda go second. Her iPad's better than my thing, so.
I'll make a motion to accept the minutes from February 1st, 2021.
And I will second that motion.
All in favor, say aye.
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 Unanimous. Next item is incoming correspondence.
This PFSA, this is what we talked about a month or two ago, right?
Yeah, so
Yeah.
that was
Yeah.
reference to the same thing.
Yeah.
And you can see with this month's correspondence that there is a letter there from DEP basically telling the town that they need to address this issue. But the DEP letter states that they have, I think it's like a 10-month time frame. So then the second letter behind that is a letter from Bruce Harper from the North Chelmsford Water District, essentially asking them to put a faster time frame on it because he's concerned about the wells.
So, and for Virginia, this is the PFAS, the polyfluorinated alkyl substances that apparently are small. They go into water supplies. They don't come out of water supplies. And it's something that we've been made aware of. And that this is one of our main fears for the water supply, not having access to the to adequate sewage capacity.
So now there's no response yet from DEP on that.
There is actually.
Oh, there is. I did not get that copy.
It came in late Monday.
Oh, I did not see that one yet.
I'll forward it to you, Sue, if you want to share it with the board.
Thank you.
Yeah.
We're expensive. I'm looking at the mosquito control project.
Well, don't forget, that's 44 communities.
No, I'm looking at the Chelmsford portion, 88,000.
Yeah, it's a formula that was developed based on wetlands, not just size, but wetlands and population living near the ranges of influence for mosquitoes from those same wetlands. And like Westford's even higher than we are, even though they're a little bit physically smaller. So it's a formula that, you know, people have a hard time wrapping their head around until they actually look at the breakdown of what they're actually applying for. So yeah, we've always been, of course, again, we're one of the bigger communities too, size-wise and wetland-wise, so.
I got worried when I saw Mr. Hoey after everything that went on the end of last week in Lowell.
Oh, And then for the oil release threat, that's also from the DEP. Those two letters are exactly the same, and they're
Hmm.
both referencing 83 Middlesex Street. The only reason they
Mhm.
sent us 2 copies is because they sent one to Emerson Avenue, and then they sent the other one to Project Compass at 83 Middlesex, but they're the same exact letter.
Okay.
Okay.
Sue, did you have any issues with any of these?
No. No, just, I'll be anxious to see the, what, once Virginia gets a chance to forward that to me, and I'll forward it to you, the response from DEP on the whole water district thing.
Yeah.
Okay.
Yeah.
Okay.
You ready, Richard?
I am, yeah. But do we, yeah, no, I'm fine with all the correspondence. I guess the question is, do we wait for the thing from the state on the well issue down Richardson Road, or do we just come back to it when we finally
Sent it.
come back on? You sent it, okay.
Yeah, I just got it, I think. Let's see if I can. Donna, if I forward it to you, can you share it on the screen?
I can certainly give it a shot.
Because I know you're in control of the meeting, so. I just sent it.
Okay. Nothing yet.
Relaxing.
No, you didn't get it.
I haven't gotten anything yet.
No, I think it was sent to Donna, and she's going to try to project it on the
Oh.
screen.
I thought she
Oh.
sent it to all of us.
No,
Okay.
Okay,
No.
scroll.
To Donna.
okay.
It's
Okay.
3 pages, so let me know when you want to.
Did you get it, Donna?
Yeah,
Yeah.
can you see it on the screen?
I
Yep.
can,
Yep,
I can.
okay.
I'm okay when other people are okay.
I'm
Okay.
good.
Good?
Yeah, I'm
Yeah.
good.
Whoops. Bless you.
Thank you. What are the 3 drums, by the way?
Old oil drums, I believe,
Just from like something
From
buried in 50, 100 years?
prior to town sewer, prior to tying into sewer.
Okay.
That's my understanding. So
I'm
Virginia,
scroll down.
it looks like they're being much more specific with what they want as far as the specific test sites in this letter. Am I correct in that?
Yeah, I can't say I've digested even the original plan yet, but
Yeah, it's very deep.
my understanding is that this letter is addressing some of the concerns that the North Chelmsford Water Department had
Yep.
about testing at more sites and trying to localize the source. I see Paul Haverty's on the call. He may have a better understanding than I do.
Yeah, and I think they added, which was not in the first proposal, these additional installation of the additional wells. It looks like that North Chelmsford Water was asking for.
All right.
Chime in, Sue. I
Yeah.
don't have a very strong understanding of what's going on with this right now. Paul Cohen did send me an email earlier today asking me to draw up agreements for the North Chelmsford Water District to allow the town to put the monitoring wells on the property, but that's really my only
Okay, yeah.
exposure to this so far.
Okay, thank you. Yeah, well, Virginia just forwarded this to us. I hadn't even seen this. All I got was that last letter from DEP that the Water District had sent to them that was in our packet.
And
So,
Paul has also said he'll need approval from town meeting to allocate funds to do this.
So
okay, so that
why-
won't happen at the end of April, right?
why do they explicitly not want the monitoring well?
No, they do.
We'll go up just a wee bit.
Yeah, but yeah, you're right. There's one that they don't want put in yet until there's other data collected. So yeah,
Number 7.
right. Well, that's a
the
bedrock
bedrock.
monitoring well, which is a deep sample, not just a shallow thing with some samples in the soils of the water there.
Which I think makes sense. They want to.
Okay.
It
So they don't
appears
want
that they
Yeah.
want to
Yeah.
get other samples from the surface before they go super deep with a big, huge.
Gotcha. Okay.
Thank
Okay.
you. Thank you.
Is there,
Virginia.
thank you very much.
Yeah.
Is there anything else that anybody has questions about that or that we need to do about this at the current time?
Nope.
We just have to follow it.
So if people are ready, I will entertain motions, or I'll take motions to accept the incoming correspondence.
Motion to accept the incoming correspondence?
Second,
All in favor?
aye.
Aye.
Unanimous. Next is the outgoing correspondence.
So isn't this the project that just got voted down?
Yes,
Yeah, so we don't really need to spend much time on this, except that we've got some contamination on 1 Billerica Road.
Right.
That's the entirety of our outgoing.
yeah, and then just
That
the
and the
addition.
accessory.
Well, Board of Appeals.
I'll make a motion to accept the outgoing correspondence.
I'll second it.
All in favor? Aye.
Aye.
Unanimous. Next is the old business. COVID updates. Sue?
So we are currently, we're still updating our website on Thursdays with our current numbers. As of last Thursday, from the beginning of the pandemic, Chelmsford has a total of 2,507 cases of COVID, 2346 confirmed and 143 probable. We've had 106 deaths in town, and currently we do have 54 active cases, which has gone down significantly over the past month. this is our second, well, last week was our second week that we actually were in the yellow, which is nice because a lot of the surrounding communities around us is still in the red. We had a 3.3% positivity rate last week, and that was over the previous 14 days. So that's been continuing to tread in the downward direction, which is also good. We still have, a couple of school nurses helping us with case follow-up and investigation, along with Amanda. Darcy and I have been primarily, and Donna, of course, working on the clinics. Now that it is March 1st, we're in the situation where the state, of course, is not going to be giving us any further doses to do any first round doses. Last Thursday, what was the final number, Donna? 391 vaccines, second round doses last Thursday at last Thursday's clinic. We have a clinic scheduled tomorrow where we have 189 second doses scheduled. Then we have one scheduled on the 11th, which that's a very small one. Darcy and I are going to handle that ourselves because there's only about 24 people. And those are the people that live in the elderly housing behind the senior center that when we did the first responder clinics at the beginning of February, we had extra doses at the end of each day. So we targeted those people over the age of 75. So, and then on the 18th, we have the final one, which is also about 200. So my only concern, and I did reach out to Michelle Hanley today at Lowell General. Lowell General actually did open up more doses today. They put it out there, and I'm sure it was full in no time at all. There's talk that the Johnson & Johnson vaccine is going to be here in Massachusetts as early as next week. And then we have not been told about any change in any decision as far as allowing us to do vaccination clinics again, like we were. My only concern, and I'm going to reach out, like I said, I did reach out today. I didn't get a response back, but I will talk to Michelle Hanley. She'll get back to me because at the end of each one of these clinics, there's inevitably anywhere from, 1, 2, 3, maybe people where we have extra doses. And, I'm very proud to say that the town of Chelmsford, since we have been administering vaccine, has not wasted a single dose of vaccine. And so we're going to have some of these stragglers who will be getting their first dose at the end of this vaccine. So I want to make sure that they have an avenue to be able to get a second dose where the state's not going to be giving them to us. So we'll see what that plan's looking like, but I'm hoping we'll be able to send them to Lowell General, and especially if Lowell General is going to be getting more vaccine. So that's where we're at.
So question for the people who are homebound, are we going to have any way of reaching out to them either through Trinity or otherwise?
As of the DPH call last week, they were in the process of coming up with what they consider to be, a viable plan for people who are homebound as far as transporting the vaccine safety, maintaining the cold chain, et cetera, et cetera. And they talked on that call that hopefully by the end of March, they would have kind of a plan on how homebound people could actually be vaccinated through either like VNA or us doing a program. So it's just, it's very frustrating, from as the health director and from the health department perspective that, we were given the responsibility of managing this from the beginning. It was thrown at us by the state, dumped in our lap. We've been at it for a year. And then, doing all of the enforcement, the education, the prevention, everything. And then we finally get to the point where we can start vaccinating the people in our community, and they essentially, take the rug out from under us and say, nope, you can't give any more first round vaccine. People in our community would much prefer to stay local, stay in Chelmsford and get their vaccine in Chelmsford. But unfortunately, we are very fortunate that we have a partnership with Lowell General. And I was over there last week, and the way that they have it set up and everything is great. They're doing an awesome job. So I'm really happy that we do get to partner with them, and that it's not that far for Chelmsford residents. It's certainly much closer than Fenway and Foxborough. You know,
Except at rush hour.
but yeah, that's true. Getting over that bridge is a nightmare. Yeah. The tough part though still is people who are not computer savvy.
Yeah,
Still a real challenge. So our senior center has started to assist people in registering if they don't have a computer, if they don't have a family member who can do that. And there's still a lot of people out there that are really struggling with that.
yeah. Yeah, I think that was a mistake. I think that they should have had telephone for these people.
Yeah. And the 211 system, unfortunately, is just not very friendly. It's not user friendly at all.
Yeah.
So,
Okay.
So I think in terms of general, I mean, we're getting to the point that like 25% of the population, the total population for the country has had COVID. About 14, we're approaching 15% have gotten at least one vaccine. Currently, the hospital numbers have gone down from a peak about 3 weeks ago where they were having like 75 patients at any given time to having something in the teens, which is massively improved. It coincides both with, if you just think that the surge was kind of a continuous Thanksgiving, Christmas surge, if you look at what the state's doing with opening up the restaurants to full capacity with 6 foot distance and such, it kind of makes sense. So hopefully this bodes well, and hopefully people who, especially if you had your vaccine and it didn't work or otherwise, hopefully people are still, willing to sort of wear their masks and, take reasonable precautions. I just, I'm a little bit nervous if people get too like, cathartic when they have their second dose and go running around doing stupid things, and we see some more cases. But otherwise, there's not much. Hopefully, we're cautious. It's going the right direction.
So Eric, my understanding is even after you get the vaccination, you could be carrying and spreading the COVID. Is that correct?
I think that the preliminary studies on some of them, like I think on the Pfizer, is that you could actually be prevented from catching it and carrying it and transmitting it, whether or not you have symptoms. And I think that the problem is that on any of these things, it's not like I said, like 2 doses. It doesn't mean you are instantly immune. It means it's all percentages, 95%, et cetera. And in some respect, who has the vaccine isn't as important as what percent of the population has it. Because when 70 to 80% of the population has it, that's when everybody's protected. The virus can't move through the population as well. And so just getting out what you have, getting enough to give out sufficient amounts is more important. And in the meantime, people should be cautious. In my family, my daughter works up in Maine with patients. And so she's had it, I've had it. My wife and my son have not. And we don't go into restaurants just yet. The statement is that if you are getting together where everybody's had vaccines, it's probably okay to take the mask off and have a meal. But for me to go to the gym and then come home and assume I'm protected and be around my wife and my son who haven't had it, no. So that there are precautions. It looks good, but we shouldn't get too cavalier just yet.
Well, I haven't seen any real reduction in the number of people wearing masks. I do still see the same people running and walking without masks, but I mean, I think people have that message.
And I'm laughing because my folks live in Florida and my in-laws living down in Texas, and I don't know that they ever were particularly good about wearing them. Sorry, my family has been, and they've been very cautious. My wife's family's been very cautious, but there's a lot of people. It was, politicized early on, and if you look at like Australia, I think that this weekend, I think Sunday they had 5 new cases of COVID in the country, the entire country. They've had no deaths in over a week now, and we have to be careful. We have to make sure we don't let our guards down just yet.
Yeah. Okay.
So that was the COVID update, and there is the bio-ready community. Oh, it's a beautiful signed memorandum of understanding. Sue had asked me if I wanted to put a cover letter on this or put an addendum.
Oh, that was to the article that they were doing.
Oh, the article.
That they were doing an article for the town, essentially that was, you know, kind of advertising for the town of Chelmsford through the business, through Lisa
Yep.
Barone, stating, you know, that we are now platinum status. So she just extended an invitation because Paul Cohen had made a comment and she just didn't know if the board wanted to add a statement.
Now that letter has gone out at this point.
You know what? She was out today and I don't know. She had sent, well, she told me she sent me the final draft. And my response to her was that I had sent it off to you to see if, as the chairman, if you wanted to add anything. And that was how we left it.
Okay. So that I thought that I'm good with what they wrote.
Yeah.
In terms of for us adding, if they want us to write a separate letter, I don't know what the purpose of that would be.
No,
If
I
it's-
don't think they wanted a separate letter. I think she was just extending the invitation.
Okay.
You know, did the board want to say anything?
Okay.
Like in one sentence in the article or something like that.
Yeah. Okay.
I personally feel like the board, you know, did what we had hoped that it would do and that everybody agreed and signed the agreement and that now we're.
Right. I thought that was the important part. I got a little bit nervous. I start putting words in everybody's mouths. I'm gonna get myself in trouble here. So, okay. Do I hear a motion to accept the old business?
I'll make a motion to accept all business.
Second,
All in favor?
aye.
Aye. Unanimous. And next is the news business.
So there's a lot of documents and paperwork in the folder for new business. Because I just wanted to supply the board with copies of email chains that had gone back and forth. And the discussion is around 85 High Street, Mr. Raisbeck's property, who he is not in compliance at this point with our animal regulation, domestic animal regulation, as he has not applied for a permit. Prior to Michelle leaving, she had had communication with him back and forth regarding his property and the fact that he needed a permit. And some of this same discussion took place last year at the same time. And he was essentially saying that his property was now for agricultural use. However, you know, Michelle was under the impression that there were certain things he had made reference to it being used for farm use. We had discussions with the assessor's office. The assessor's office said, in order to be a farm, you have to have 5 acres. He doesn't have 5 acres. His business partner, Nancy, had formed an LLC. There's a copy of that. They gave us a 5-year plan for that LLC as far as fruits, vegetables, farmers markets, roadside stands, food pantry donations, etc., over the next 5 years. But even with all of that documentation, I did not see where any of that basically made him exempt from applying for an animal permit through our office. So I had engaged Paul Haverty. Paul, thank you for being here. And Mike had sent a couple of the other emails that you see in this packet, trying to support that the property at 85 High Street was now primarily used for agricultural use. I still do not find the documentation supportive of that, other than what he stated in his emails. I reached out to Frank Green, the assessor, because 85 High Street is in a residential neighborhood. It is zoned residential. It's identified as residential. And when I had the discussion with Mr. Reen, he said, according to the assessor, it is residential. And based on our regulations, we've always gone by whatever the assessors database declares the property as. You know, we have in our regulation that it can't be a two-family, it has to be a single family. And we base that on what is listed on the assessor's office. Mr. Reen went out again today to the property because I spoke to him last week and I said, well, you know, Mr. Raisbeck had sent me this information saying that he felt that the property was primarily agricultural. And Frank came back and informed me today that what he saw in just a drive-by, he does not see that it's agricultural. It is residential, and that he still considers it residential. So I did send a violation letter certified out on Friday morning to Mr. Raisbeck because and if you look at these emails, Michelle had mentioned to him in one of the emails in January where they were having these discussions, she did invite him to come to the meeting in February, but that never really went anywhere. So I felt that I was in a position where I need to rely on the board to tell me, you know, is the board going to consider this agricultural use now based on the emails and the information provided, or is the board going to decide that based on the assessor's map, it is residential and he needs a permit? His long-term plan is definitely, if you look at the 5-year plan, he eventually would like to have 50 chickens on the property. So I leave it up to the board.
And I'm going to ask other people about this, but I don't really want to be in the business of arbitrating land use in Chelmsford. I think that it was a little bit awkward to have the entire chicken issue put in our lap. There are health concerns there, but deeming something as agriculture, not agriculture, and which ones I would, and I don't think this is the kind of thing that can be said by one person, that I am my own country. That's why I would like to have an arbiter that's not us, that our town assessor is what makes within the what's set forth by the zoning board, it's a planning board, that the assessor is the one that puts the label on it, and that determines whether or not our regulations apply. Thoughts?
Yeah, no, I totally agree. I think it's not our job to determine that. And I think when this whole scenario came up on right to farm, et cetera, that it was very generalized in the way it's worded and whatever, kind of very broad and whatever, and that's fine. But the fact is that, you know, the town has to figure out how to make a decision about whether something's a farm or not. Now, I know there was some comments in there. There was something about, well, if you're going for tax, you know, tax changes and things and whatever, and whether and by the way, I'm not talking about his property. I'm talking about any property that may come down the pike in the same thing. And the town has to have some process, and it's not going to be the Board of Health, have a process in which to make a determination in regards to what the use of the property is. It's not the Board of Health's right, you know, job to find out what the use of a particular piece of property is, kind of thing. So, I mean, I think the town has to do some work in regards to figuring out, and right now, the only system that ever existed was the assessors. And Frank has been the head assessors for the last quite a few years. And I mean, until something changes about how we're going to do that, someone arbitrarily saying, oh, I'm a farm, I'm not a farm, but I'm not going to go for, I'm not applying for the tax thing yet. Okay, or maybe they will, maybe they won't, kind of thing, but determine that I'm a farm now, and then they'll say, oh, the Board of Health said that you were a farm. You know, they approved that I was a farm, kind of thing. I mean, seriously, if he wants to convert to a farm and the process, they figure out what this process is supposed to be so that legitimately someone can switch from residential to agricultural, fine and dandy. But until that time, I just don't see what this big burden is, okay, of, you know, having a permit from the Board of Health. I mean, it's not some, you know, heavily weighted permit fee or anything like that. He's already has had a permit in the past and has had a number of chickens, and overall, you know, things have been going okay there as far as I know. So I mean, fine, you pull your permit, go through the process, and when the town can finally sit there and say you are, well then fine. And if it happens before the year's out, then I guess we can give him part of his feedback or something. I mean, but the idea that we get, as you were saying, kind of, you know, arbitrating, you know, whether you're this and whether you're that, you're right. It really shouldn't be up to us and shouldn't be thrown at us. But here we are de facto in the fact that, you know, we're currently issuing permits on it, and someone wants to transition from a facility, piece of property, a zoning, whatever you want to call it, to something that's not underneath our regulations. Well, then fine, go through the process. The town figure out how they want to do that for everybody. Okay, and then we go from there. Legally, but in the meantime, just renew your permit and then work your way through this stuff, and then it's over. So we're not here to stop them from becoming a farm.
Emery and Paul, legally, I want your opinions in general, and then specifically, what does it say in the bylaws about how these things are determined? When we wrote in our regulation, these apply to residential properties, you know, what was that based on, saying it's a residential versus agricultural?
So the bylaw states these regulations are not intended to apply to any parcel or parcels of land used for the primary purpose of commercial agriculture or accessory thereto, the use of which is governed by the provisions of Chapter 127, Right to Farm of the Town of Chelmsford bylaws. There is no minimum lot acreage requirement under Chapter 127. There is no minimum lot acreage for a farming use anywhere in the Commonwealth of Massachusetts. There are provisions with that you can get an exemption from zoning bylaws. It's 5-acre farm or larger. Under Chapter 48, Section 3, you can be exempt from zoning bylaws. However, that can actually go down to as low as 2 acres, depending on the activity that goes on the farm. Are
those contiguous?
Excuse me?
Are those contiguous?
They would have to be contiguous to comply for the zoning relief, yes.
Because he's saying like 1.5, 1.5, 1.5.
Right, but so that's really neither here nor there. So they would not be able to qualify for the zoning exemption. However, Chelmsford zoning bylaws allows non-exempt farm uses in single-family residence zones.
And who's supposed to do that? That's the question.
Who's supposed to make
to decide whether he's no longer
farm?
residential and going to a farm? Who? That's the question. Who?
And that's a fair question. I mean, again, I think that it's certainly, you know, viable to rely upon the determination of the assessor. I'm not necessarily sure the assessor wants to be the one.
Oh yeah, no, I'm not.
It's stuck making that decision as well.
Not to interrupt you, Paul, but so Frank did say to me when I talked to him about it, that, you know, he said in a drive-by, which was done today, he would definitely not deem it agricultural use. However, if Mr. Raisbeck, as the owner of the property at 85 High Street, you know, he basically said if he wanted to have him go out and do a full assessment on site, inside, outside, you know, with the barn and the whole bit, to potentially have the use changed for agricultural use, that he would be willing to do that. But from what he sees right now, from what he, and I don't think it's, he said it was kind of a mess. I don't know if it's because it's winter, whatever, but he said as of right now, it is residential. So when I'm enforcing our regulation, like I said in the beginning, we've always just gone by what is on the assessors. And so we do have, you know, that very first paragraph in our domestic animal regulation, what you just read. But again, if the primary purpose is commercial agricultural, and according to the assessor's office, it is not. It is primarily residential. So what I need from the board is, where do we go from here as far as Mr. Raisbeck not paying his $50 and submitting a renewal application because he wants the use to primarily be, you know, and the other thing is that if his long-term plan is that he eventually wants 50 chickens on the property, that's not going to happen under our current regulation with residential use because our maximum is 20.
Right, but if, I don't know if we need to amend our regulation to further,
I'm
or if
not
we can
saying-
just go.
No, stop.
Right, right,
Don't
right.
even
Okay.
start talking about that. That's all
Exactly.
he wants, okay?
But
So
as
you know
long
what?
as
This
Mr.
is
Fife-
really, Liz, can I please speak?
Mhm.
Yeah, go ahead.
Okay, this is very clever of Mike and his girlfriend, okay? But I'm sorry, this is zoned residential and the primary use of this property is residential. They live there, they sleep there, okay? The land, it's a small lot of land. The house that they occupy is as large as the lot of land there. They keep throwing out this right to farm. This is a red herring. They did this when we were doing the regulations. That right to farm's not giving them any protection here at all, but they throw it out there because they know it gets people all excited about the right to farm. My position is it's zoned residential. He can't farm there without a use variance. A use variance is going to require his neighbors to come in and give their opinion. I don't think we do anything.
Mhm.
I'm
And
happy
Mary, if I
just
could just-
discussing
If I
him
could just
$50
clarify
a
that
day.
last point, he does not require a use variance to use that property as a farm. But non-exempt farming
My
agriculture
mistake then.
is allowed as of right in residential zoning districts.
Okay, then I misunderstood that when I read through what I did earlier today. But I just think he's been provoking us right from the beginning. And I say, stand down, assess the $50 a day, let him take the next move.
Okay.
That's my
And-
opinion. I'll be gone in 2 months, so.
Well,
I mean,
again,
I'm so annoyed by them because this is continuation of what was going on when we had all those hearings, when they were swearing at us, you know, when people were telling us they were going to sue us. I'm tired of it personally. And I think this is selfishly motivated. I don't think there's anything to do with farmers. He just wants to raise livestock on that little lot of land.
well, again, I think it's real simple. I think the town, through some process, and I'm not talking about sticking it to the assessors and dropping on him because it might be the easiest way to do it. I don't particularly care. But the issue is we're not going to do it. And the answer
No.
is following our procedures that we've had for a blank number of years. The fact is that, yes, we need to go forward with what we do. And if they can, the town and others can work out a process that someone makes a determination when someone makes a switch. Okay, who makes the determination? Is it the assessor? Is it who? Figure it out. But it's not the Board of Health's job to figure it out.
No.
And again, I'm not throwing it in any particular direction. The issue is, but yeah, if this is the scenario that exists underneath this right to farm thing, wonderful. Then I guess that everybody didn't think it totally through about, well, how do you resolve it? How do you resolve people switching from residential to this primary commercial farming, but only have to do this minimum amount of whatever on their piece of property to meet the criteria kind of thing? Okay. And again, if that's what they want, fine and dandy, but they better have a process so that everybody can get along in with it and go through it. And hey, you do, you don't. And if you, and again, and if there's complaints, well, good, go to the, whatever the agricultural, is it commission? I forget what they're calling themselves now. Didn't they create an agricultural?
We're really getting far off here,
Oh, I
all
know.
right?
I agree. For us,
I think that the question is whether or not we keep assessing them the penalty.
Yep. Yeah.
Okay,
So-
and the town's gonna have to deal with the residential use. It's not something we can deal with.
Right. We are
Right.
not going to arbitrate. We have a regulation in place that defines, we've always used the assessor's assessment. And on that basis, as a Board of Health, that I propose that we support Sue and the department in going forward and treating this as a residential community with unregistered chickens, and that she goes through per the regulation and does what she needs to do. So
Second.
you need
You want a motion or?
that was it. Yep. So all in favor, say aye.
Aye.
Okay, Sue, you good?
Okay, yep. So I mean, like I said, I sent the letter on Friday. I haven't heard anything yet because it was only sent Friday morning. And we'll see if he responds to the letter by either filling out the permit, or if he doesn't respond, do I issue him a notice to a hearing to come before the board next month? I mean, we have all the documentation. I don't feel that we need any further documentation from him. I think he's provided us everything. I feel like the decision's been made.
Anne Marie would say 2 months.
No, you know what? He's not gonna show up until April or May. Really,
So-
you know, he's made that very obvious.
Yeah, but Sue, that would be our standard procedure, is that
Yes.
if he did not respond, that we would ask him to have a hearing at the next meeting, correct?
Yes.
So
Well-
go with our usual modus operandi, okay?
Okay.
Well, I'm gonna object to that. I'm gonna say I just keep fining him till he comes back in for a permit.
Well, he's gotten, the letter went out stating that
Yeah.
he's fined daily for not.
I just keep fining him because, this is one thing after another, one thing after another, one thing after another, and it's, I don't know, it's exasperating.
I
No
think that we
respect
all,
whatsoever. No respect for this board at all.
there was a lot of stress. I would say just keep things the same, that we treat him the same as we would anybody else.
Yep.
And so that we don't put ourselves out for a violation by treating him differently. And this is the same with
I
anybody
will
else.
certainly defer to the two of you. You've got to live with whatever gets decided with, you've got to live with. And the neighbors have got to live with it, whatever you decide with too.
So,
I don't have a
okay,
problem. Yes.
okay. Any further votes on new business? I think that was the entirety of it.
Right.
So, okay, to move on to other?
Yes.
You all set with me?
Yes. Thank you, Paul. I'm
Thank you,
sorry.
Paul.
Good night, everyone.
Oh,
Oh, we
Sue,
gotta
anything
figure out
else?
who.
You have? Okay, thank you, Paul.
Thanks. Okay, so.
I was actually able to take a few minutes to summarize in my monthly report the number of clinics that we've had. And we were able to do, up to this point, we've done 2,421 vaccines
Right.
with the 3 more clinics to go.
That's great.
And the state wants to take that capacity and just throw it out the window like it wouldn't be beneficial to the residents, your town, of course, but also the residents' general statement of having more people done in the period of time going forward. So whatever. And
Did you-
what I'm also going to say, that we do it, I don't want to say more efficiently, but we do it efficiently. We do it very much cost efficiently.
Mm.
The idea that someone else has to pick up some bill because we're paying for this party to do this or that party to do that or whatever, none of that's happening. Okay, but that's okay. We're not spending any other money than what we're being paid for in the volunteers. But yeah, just take that capacity and just take it right off the table.
Did anybody see the interview with the public health director for the state of West Virginia?
No, I didn't.
They got a lot of attention because they're the ones that have the highest proportion of their population immunized. And they asked, well, how is it that you are the best? And Massachusetts is in the bottom half. And they didn't ask her that in particular. And she said, they just figured that the moment that this thing bust out, they figured that there's going to be a vaccine and they're going to have to figure out how to distribute it at some point. And I think that the problem that we've had is that we've done an awful lot of that Sue's done a lot of great work and her department's done a lot of great work and deserves a lot of praise. But it's like people keep changing who they think, how they think. So they go ahead and tell Sue that she's got to figure the whole thing out. She solves their problem for them. And then they turn around and say, well, we're going to go and put all the vaccines in Gillette and everybody can get in their car and drive after they figure out how to log in electronically.
Yes.
Yeah.
So I've lived in fear of calling Sue because during the pandemic, she's had everything else going on. And usually each have 2 or 3 things going on at once. I've always been in fear of calling Anne Marie, not because of Anne Marie, but because for fear that somebody was going to say that we were colluding.
Colluding, yeah.
Yeah.
The idea that
Well,
I can
that's from the
actually,
Russians, right?
Mm.
I think I talk to Eric Kaplan still more often than I talk to you on a phone.
Just as an FYI, we are starting interviews next week for the department assistant job. We have a few people who have applied.
Well, I wasn't sure if Donna was going to be sitting there controlling the meeting this time or not.
Oh, yeah. Dawn is doing dual roles right now. Thank goodness.
When it says Alpine Lane had a group of mice on the side of the main entrance, that's the main entrance of the street, or is that a specific business?
In the back. And
Where all the dumpsters are.
yeah, and Mark went
Yeah.
out there and he didn't see any activity at all.
Okay. All right. When people are ready, I will listen for a motion to accept.
Motion to
I'm a-
accept. Go ahead.
I'll second that.
All in favor, say aye.
Aye.
Aye. Does anybody have anything else that they would like to discuss officially at tonight's
Officially?
meeting?
Nope.
Well, with the new guidelines, as far as things opening up, I think we're going to see, I know that some of the restaurants are considering putting back outside tents to be able to expand their capacity now with the new guidance and with more things opening up. So that will help local business as well if they put the tents back up now that it's getting warmer, because now it's not a capacity thing, it's the 6-foot distance thing.
And so they still have to have 6 feet indoor or outdoor,
Yes.
correct?
Yes.
Okay.
Yep, or the barriers that go up.
Yeah.
Yep.
Sounds good.
All right.
Sue, we had this conversation before. How far up do those barriers have to go?
Yeah, they have to be, we had that discussion earlier today in the office, actually. They definitely have to be high enough so that, it covers your face and your breathing area.
Mhm.
It's 6 feet.
Yeah.
Standing or sitting?
In total, it has to be 6 feet
6 feet.
6 feet, okay.
from the ground up.
Okay, from the ground?
Mhm. So that
Which
if you
would
have
be
tables
most people.
beside each other,
Yeah.
Yeah,
not at 6 feet, it's gonna block the, above their head, sitting down.
Okay. I see that we have a public input, so I will open it for public input. I think we're at the point now, we got Pete over at CTM and Virginia that are still on with us. If they care
Okay.
to make any comments.
Nope.
And if anybody's talking, your mutes are on. If the mutes don't go off, then I'll go ahead and close public input for tonight. And Sue, I think that Dr. Jacques Salahian has an interview with Jay Lang on Wednesday morning at 7:30 a.m. for the school board's school physician position.
oh, good.
Okay,
Good.
so one of my colleagues in the office, and so that will help us to sort of coordinate if and when you need it. Okay,
Perfect.
okay, and I will listen for a motion to close tonight's meeting.
Motion to adjourn.
Second.
All in favor?
Aye.
I'm gonna miss you, Anne Marie.
Aye.